My name is Gok Ratnarajan, Consultant Ophthalmic Surgeon and Director of Innovation Eye Clinic, and we've been kindly invited to Lennox Cato's antique shop here in Edenbridge. Lennox, tell me a little bit about your eye journey.
Well, it was, now looking back, it was slightly traumatic, but thank goodness I had a good team around me. Initially, I woke up and I felt as though I had cling film over my eye, and it was really disconcerting because I couldn't see, and I could see light and dark, but I couldn't focus on anything.
Wow.
And having that experience, losing one of your senses is really scary when you don't know what it is. And I had no idea what was happening. I just suddenly thought, oh my God, what's happened to my eye? I was really, really worried.
So what did you do?
I went down to our local optometrist in the high street here in Edenbridge, and he said, have you been in an accident? Have you suffered trauma? Have you had a bang on the head? I said, no. I've literally just woken up and I can't see out of this eye. And I think he could feel my concern.
Absolutely, yeah, I can imagine.
But anyway, so he did all these various tests, and then he said the words, yes, you've got a serious cataract. Oh, that's what it is. I just think of older people having cataracts.
Absolutely, yeah.
I don't count myself as being old yet.
So, you've been told you've got cataracts, you suddenly can't see clearly out of one eye. How did that make you feel inside?
Really mixed up, really anxious. I was worried. I thought, what do I do? What do I do? How do I move forward? He was so reassuring. He said, don't worry. There's a way we can do this, and put various propositions to me. And I said, fine, let's do it. I want this dealt with as soon as possible. In my profession, it's all about looking and having the eye, and when you can't see something, it's or you've got restricted vision. No.
Yeah. So I remember when you came to see me in the clinic, and I asked some of the similar questions. The fact that one eye has good vision and the other eye vision had dropped so quickly over a period of a few months. That's quite atypical for cataracts, because cataracts tend to be more bilateral and slowly progressive, and they occur over a period of many years, and that's why a lot of people don't notice it, because both eyes, the vision drops off at the same time.
Right.
Because yours was a bit atypical in that one eye developed a cataract quite quickly. So the questions that your optician asked, the same question that I asked you about trauma or any injury to the eye. And then we talked about the different lens options, and we talked about the premium lenses that you had to give you good distance and intermediate vision, but balancing out between the two eyes. So going on from that, how did you feel when it came on to say, well, actually, I need an operation on this very delicate part of my eye? Because a lot of people are squeamish, aren't they?
I presume they are. I mean, it is disconcerting, but for me, it was needs must, and there was no hesitation.
So Lennox, tell me a little bit about the actual operation itself, your experiences and how you were during those sort of 10, 12 minutes when you were having the surgery done.
Absolutely brilliant. They make you at ease. Nothing's a problem, and so yes, you're relaxed, but you still have some butterflies. Then so when I got into the theatre to have the operation, again, I didn't know what to expect, but you explained it very well.
There are all different types of patients, and I think for me, being under a drape, having your eye operated on is a very vulnerable period, and I think a little bit of encouragement to let you know how things are going, and that gentle encouragement, I think, is a very big part of what makes patients' eye surgery not so bad. I often tell patients that I'm just going to getting the lens ready now, and the lens is going into the eye.
Yeah.
As that lens was going in, could you start to see the colours and the brightness coming back?
I can't quite remember, to be honest, but what I do remember is that when I got home, and because everything was happening, it's almost like being in a dream. because and also it's out of my control. It was all down to you and your team. But when I got home, then I could be in my own space and relaxing. And we sat in the conservatory, and we've got a very pretty garden, and we're sitting there just looking at the garden. What it makes you do is realise how fortunate I am that this had been carried out and done so quickly. But what I've found, as it's almost like being a child, because you looked at the flowers and the colours in our room, and it's like a child looking at things for the first time. The colours were so vibrant, the reds, the greens, the blues, and I think as we get older we kind of now realise that your eyes are getting weaker and weaker, but a child's eyes, they see these lovely colours.
Yeah.
And that's what I saw. It's like, to me, looking at things for the first time.
Yeah.
And it's wonderful, and I still,
And for your job, when you took me for a tour around your fantastic shop and all the colours that we're seeing, this table in front of us, and before you were talking me through all the details of the different types of woods, for you who appreciates the world and the colour in a very different way to me and probably most people, being so expert in your field, it's lovely to hear that. And I get asked a few times a week, why do you want to be an eye surgeon? The eyes are so squeamish, and how can you be an eye surgeon? And my kids would often say, oh daddy, how can you do that for a job? But I think what you just said there, and I love my job, and I'm very proud and honoured to do what I do, and to hear someone like yourself and all my patients who have similar experiences, it's the best thing, #love your job type thing. It really is amazing.